Hello people, welcome back to my channel. So today we're going to go over the standards of clinical practice. Oh, Jesus Christ, this is so long. Like, look at this is the whole contents, okay? And we're gonna have to go through all of it. Not today, not in one video. I'm gonna set this timer for 25 minutes and we're gonna get through as much as we possibly can. So before we begin, let's just focus on this exam. So what ends up happening in undergrad is that, for the most part, you get information, you memorize it, and then you spit it out. You don't necessarily apply it. But in this exam, we're going to have to take all the information that's given in this document and the other few documents that they recommend that you look over. We're going to take that as the learning objective and be able to apply that information in a session, because that's sort of what, actually, that's exactly what's going to end up happening. You know, they're clinical-based questions. And you have to pick the best answer, not the correct answer. And the best answer is based on all of these, okay? So let's dive in, shall we? So whenever I do these, I don't know, maybe I talk a little too fast, but that's how I study. So I don't know, if anybody studies a little bit differently, let me know. If you want me to explore things a little bit differently, let me know. So I'm just going to read what it says here, and then we'll kind of rephrase it as we go. So first it has the definition of music therapy is the clinical and evidence-based use of music therapy interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Are you telling me that I don't need to be board certified to practice music therapy? That's what I literally read from this, right? The definition of music therapy is to use music interventions from a clinical, evidence-based, obviously we're getting clinical hours. Obviously it's evidence-based because it's based off of research, and we're accomplishing individualized goals. And it's by a professional who has completed an approved music therapy program. So, you know, AMTA approves lots of music therapy programs. I'm not even going to go there because we're getting board certified. Okay, further clarification. Oh, here we go. Clinical and evidence-based is a relationship between music therapy research and clinical practice. Didn't I just say that? Yes. I'm like really smart. I already know the answer before we get to it. Musical interventions is a purpose-driven, purpose-driven musical experiences. I don't understand. Why would I just randomly sing to someone unless there was a purpose? I don't get it. Individualized goals within a therapeutic relationship. And then it talks about assessment, treatment planning, intervention, evaluation. That's like just a standard rule. Assessment, treatment, intervention, evaluation. Okay, like that's like the golden rule overall. Here we go. This answers my question. Accredited professional. Oh, and here we go. What? They have MTBC. What's RMT or CMT? I've never heard of either of those. Okay, and you have to fulfill the competencies and maintain standard. Okay, so they answered my, darn it. Of course you have to be board certified because these people get some of the money from it. You know it's all a business. You know it's all a business. That's why they don't have like tutoring sessions, because like they know if they have tutoring sessions that we'll all pass and they won't make a dime out of us. I got you. Approved music therapy program. Yeah, that's what I thought. Okay. Anyway, music therapy services are rendered by a music therapist, professional members of the AMTA. Although music therapy services exist in a diverse setting, there are common procedures. Additional services may differentiate. So, okay, then it talks about addictive disorders, consultant, intellectual and developmental disabilities, educational settings, older adults, medical settings, mental health, private practice, wellness practice. Oh, that's everything. They're just renaming everything on the table of contents, which we are going to go through each of them because I do have something to say, of course. Just to let you guys know, I did work in a lot of different facilities, okay? Because I always use the rule of 3. If I don't like something, I have to try it 3 times before I actually decide I don't like it. Okay, so then we have the Code of Ethics, Standard of Clinical Practice. Yeah, and then they can change this at any time. Okay, introduction. Okay, so this is rules for measuring quality of service. It's made by the AMTA, blah, blah, blah. Okay, the reader should read the general standards first and have them in hand when reading the specific standards. Alright, whatever you say. General standards. Now we can set our timer. Because we just went through. Oh, I already set it. Okay. Okay, so general standard. Here we go. So music therapy, general procedures. Okay, here we go. So we have referral and acceptance, assessment, treatment planning, implementation, documentation, and termination. That's like number 6. So I'm just going to let you guys know that referral and acceptance, usually the facility gets the patient and the patient accepts from the facility. I remember I worked at this one facility, they had a wait list, so obviously like people accepted, you know. And then assessment, that's the part that you're responsible for. Hopefully in your internship you'll be able to do an assessment on a patient. It's kind of, you just kind of like do whatever type of music, you know, and always record it if you can. And then treatment planning, that's an obvious one because that's what we do, and I'm sure you'll have plenty of practice before taking this exam. Implementation, that's the largest part of our job, which I absolutely don't like. Documentation, which I actually like. I used to have to do 40 patient documentation in Epic, which is the medical professional software that they use at a lot of different hospitals. So I used to have to do Epics for the whole chart for 40 different patients in 3 hours. I like documentation. I'm good at it. Termination. And termination, again, usually it's not your fault. Usually it's something to do with the facility, something to do with money, something to do with insurance. Sometimes you don't even have a termination session with the client. Okay, so moving on, it says decisions affecting the quality of services should be based on professional judgment of the music therapist in regard to the client ratio, caseload, frequency, length, duration of sessions. Okay, no. As a music therapist, you don't have any say in client to client ratio. You don't have any say in your caseload for the most part either. Usually your caseload is assigned to you, and the client therapist ratio, again, it's based on money. It's based on how many clients can we fit in a room that will generate enough revenue to pay the music therapist and possibly a supporting staff. For the most part, you don't have a support staff, and you need a support staff in a session of like 4+ clients for the most part, but you probably won't get one, and it's all based on money, and it's all based on the higher ups. Us as music therapists, you can say whatever you want, but you usually don't get your way, okay? Then at caseload 2, that's something that's usually determined by your department head. And usually if you're getting a job, it's because you're taking somebody else's job. So somebody already did this caseload. So yet again, you don't really have a say, okay? Frequency, length, and duration of sessions, it all depends on insurance and what the facility wants, you know. Usually the sessions are at least an hour, and it's 2 times a week, if that, you know. But again, it depends on insurance, it depends on the facility. We don't have any say in that, unfortunately. Music therapists will allocate time needed to execute responsibilities such as administration, in-service, and services related to client care in order to provide quality, direct client services. Again, this is something that doesn't necessarily happen in real life. So, music therapists allocate time for responsibilities in administration. We all know that that doesn't happen because there's companies out here who are like paying therapists to do music therapy sessions, but not necessarily paying them to do the documentation. So clearly that this doesn't happen in real life. In service and services, I worked at a facility that refused to give any time for professional development. Like they would give you, I think, like a day, which obviously isn't feasible if you're going to conference. So moving on, you can advocate. Maybe if you stay at the facility long enough, you might be able to get your way in these aspects, okay? Just keep that in mind. This isn't a total no. It's just a no when you're entry level. The recipient of music therapy services, we have client, consumer, patient, resident, or student, and there's such diversity terminology reflected in this document. Again, it really depends on the facility. So some facilities call clients clients, other facilities call clients patients. It depends, and the client will tell you what they prefer. That's happened to me before. Okay, we have standard, referral, and acceptance. This is a stupid category considering the facility does this for you, but whatever. A client will be accepted for music therapy in accordance with the specific criteria. A client may be a candidate for music therapy when cognitive, communication, psychological, education, social, and physiological needs may be needed. So, yeah, again, we all know that music therapy can be used for a number of different ways, but for this exam, this is really important. Cognitive, communication, psych, education, right? Social, and then physical. And then also you can remember like cognitive behavioral therapy, like that would be sort of the co-treat. Physical would be, PTOT, social, drum circle, bell choir, what was the other one I said? Karaoke. Psychological, obviously, because we're a therapist. Education, if you're working with kids sometimes. And then communication, obviously, that's why we have instruments. A client may be referred to an initial music therapy assessment by another music therapist, for sure. Members of disciplines or agencies, for sure. From themselves, that happens too. Parent, guardian, advocacies, representatives. Certain insurance companies will only let you see a specialist, and a music therapist would be considered a specialist in this example. They'll only let you see a specialist if you go to your primary care physician. So if you're a music therapist looking for clients because you're an independent contractor, get really friendly with the primary care specialist in your area, or the pediatrician if you're into working with kids, because usually for most insurance companies, at least the ones around here that are popular, you'll need a referral from the primary care physician in order for the services to be accepted by insurance. So if you're looking for clients, get friendly with the primary care physicians. The final decision to accept a client for a music therapy assessment will be the music therapist. Yes, you do have a say in that. I don't know why you would say no to somebody though. Standard assessment. A client will be assessed by a music therapist. The assessment includes general categories. Okay, so I'm going to read these off, but then I'll dive in a little deeper. So we have, again, psychological, cognitive, communicative, social, physiological, functioning, focused on clients' needs and strengths. The assessment will also determine the client's response to music, musical skills, and music preferences. So when you assess a client, usually what ends up happening is the primary care physician, for example, will say, oh, this child was diagnosed with ADHD. They have been taking medication for X amount of months. In school, they are not very social. They have difficulty expressing themselves, but they really like listening to music on YouTube. I recommend this person for music therapy. That's usually what ends up happening, right? So then you already, and sometimes even some professionals will say, like, oh, this client, these are their goals, these are their objectives. Can you see him? So sometimes it's already outlined for you. But in our first example, again, it was kind of already outlined, like, oh, he's having issues with communication, he's having issues socializing. So it's kind of already outlined for you. In a real music therapy assessment, because I know this seems like a lot of information, you really want to pull out the musical skills, you really want to pull out the musical interest in the client, and you want to see, like, what they really react to in general. So if we're taking this child who's ADHD, and he's having issues communicating and socializing, well, you bring out a drum, he doesn't do anything. You bring out a piano, doesn't do anything. You bring out an iPad, he gets all excited, he takes the iPad and goes on YouTube and shows you his favorite song, So then, there you go. Then you see, okay, well, he likes technology, he likes YouTube, he likes this type of music. This is how he expresses himself. Do you get what I'm saying? Why did I ask you a rhetorical question? Moving on, this is 2.2. The music therapy assessment will explore the client's culture to some degree. You don't really cover that much background. It's usually like a 30-minute session, if that, and sometimes facilities don't charge for the assessment, so they want you to make it as short and efficient as possible, okay? So this can include race, ethnicity, language, religion, spiritual, family experience, sexual orientation, gender expression, social organizations. Usually you don't cover any of this in an assessment. I'm just going to be honest. You talk about clients, age, diagnosis, functioning level. This kind of comes up, when you go through a musical assessment, you kind of already figure out what's appropriate music-wise for the client, what's their functioning. And then interpret all test results. The music therapy assessment procedure and results will become a part of the client's file. The final decision for music therapy services will be made by the interdisciplinary team. One thing to say about that is that sometimes people on the team get a little jealous if it's PT and their session gets cut short because the client gets music therapy. So that's sometimes why you'll get the short end of the stick, or sometimes you don't see the client initially when they enter into the facility or the program, okay? The final decision to accept, okay, I did that one. The result, conclusions, and implications of the music therapy assessment will become the basis for the client's music therapy program. Really, the assessment just gives you an idea of what goal and objectives to do initially. You'll get to know the client more the more you work with them. So you're gonna be looking at the assessment initially, but then once you start working with the client for like 6 months, you'll start to know them, so you won't necessarily need that initial assessment anymore. When the assessment indicates other services, the music therapist will make an appropriate referral. Usually they need music therapy all around, It's because we're the best, that's why. Okay, standard 3, treatment planning. The music therapist will develop an individualized treatment plan upon the music therapy assessment and the client's prognosis. The client will participate in the program when appropriate. So the music therapy program, is designed to help the client attain and maintain maximum level of functioning, comply with regulations. We have type, frequency, and duration of music therapy, goals that focus on assessment, objectives that focus on assessment, specified procedures that includes instruments or musical elements, a periodic evaluation optimized according to professional judgment, program plans of other disciplines, establish principles of normal growth and development, and change to meet the priority needs of a client during a crisis intervention. So, here's the thing. Crisis intervention is number one priority out of this whole entire list, to be honest, because you never ever know when those are going to hit. One time I had this client who literally had a major breakdown, and it was around lunchtime. So everybody, all the higher ups were at lunch, and she literally had this full-on mental breakdown, in the middle of the hallway, and she was throwing things, she was screaming, she was kicking, and it was very dangerous for all the clients around. So everybody had to come in and do crisis intervention. And at that facility, we actually had a team of individuals who did do crisis interventions and were trained in how to assist physically and emotionally in that type of situation. But that's the most important thing, because you want to make sure, does this client have seizures? Is that a crisis for this particular client? Does this client have mental breakdowns? Is this client gonna kick me or kick another client, or set the building on fire? You know what I mean? So that's initially the most important thing. And then moving next would be goals and objectives, of course. This is what you're gonna use as your basis to track, and this is what you're gonna use as your pull when you need, when people want to get rid of you, or if they want the client to move to somebody else. Duration and frequency, that's usually based on, it's always better to do, it's just practicing, 15 minutes 3 times a week is better than 2 hours on a Friday, but you don't really get a say in it, okay? Okay, help the client maintain maximum level of functioning. This one is so subjective, because sometimes maintaining functioning is maximum level of functioning. When I worked in acquired brain injury, that's the way it was. Maintaining their ability was maximum ability. They didn't necessarily progress. And that was really hard to advocate for. Comply with federal, your organization is going to make sure that you do that, because they don't want to lose their accreditation. And then evaluation, again, the facility is going to have an evaluation for the client and the services. Here we go, standard 4, implementation. I'm getting tired of talking. A music therapist will deliver services according to the written program plan. Strive for the highest level and quality of musical involvement. Again, sometimes clients just need to maintain their level of functioning. They don't necessarily need to improve it. Sometimes they can't improve it. A music therapist will reflect on their abilities as a musician. I don't really think that this is appropriate. Just the way it's phrased. Yes, you should journal. Yes, you should reflect on the session. Yes, you should strive to be better at the next session. But you should not be self-critiquing your musicality. If you are in internship as a music therapist, if you're even in practicum, if you're even in a music therapy program, if you got a job as a music therapist, your music skills are fine. It's just the way you went about the session that might have needed improvement. Appropriate music instruments and materials. That is true. So you want to think about okay, piano and guitar are always the go-to, but is it more feasible to do guitar because I can get in the client's face? Is it more feasible to do piano because this is a relaxing song, and these clients appear to associate piano with relaxing? Is it appropriate to bring in my flute? Oh, it's probably not appropriate, because the flute is very open and empty without a background bass. Is it appropriate to play bass? Well, maybe in a Halloween session, but not in a typical session, because it's too low. It's vibrating at too low of a frequency. So these types of things you need to be thinking about. And you'll get practice thinking about this and doing this as you start working, as you start your internship. Music therapists will make an effort to ensure safety and quality of patients. That's like number one. Use advances in health, safety, and infection control. Have any of us learned? At this point, we all went through COVID-19. I'm sure we all know the appropriate. You want to check the CDC and the state website. Okay, those are the two sources you need to use for infection control. Those are the two reliable. Maintain close communication with others involving the client. Yeah, you should be going to meetings. There was one time I had to argue to go to a client meeting, which was so stupid. Gee, I wonder what stupid supervisor made me do that. Record the schedule and procedures of music therapy treatment for sure, because you're going to need it for billing. Evaluate the client's responses towards goals and objectives. This is where the client could move like an inch, and that's worth recording. And you want those to be all objective. Evaluate the client's response periodically. Incorporate the results in the evaluations in subsequent treatment. I think they just mean apply it when necessary in meetings, moving forward. Consider the psychological effects of music therapy termination of services. Again, termination isn't something that we necessarily have control over for the most part. Standard 5, documentation. Look at how big that, no, it's not really that big, but you need to get paid for your documentation. That's what's up. Music therapists will document client referral, assessment. We finished. Okay, I guess we'll have to continue documentation in the next video. Talk to you guys later. Bye!